My name is Andrew Symons. I'm a family physician. I'm the Vice Chair for Medical Student Education of the Department of Family Medicine at the University of Buffalo in New York. The book that I co-authored was Differential Diagnosis of Common Complaints, and this is the 6th edition. Our book is symptom-based, so the chapters there's no chapter on congestive heart failure or pneumonia. There's no chapter on heart attack. There are chapters on chest pain, shortness of breath, backache, cough. That's how patients come into the office. That's how they come to their family doctor. Perhaps by the time they see the specialist, they know that they have congestive heart failure or they know that they've had a heart attack, but when they come to their doctor, their family physician, they say, I don't feel well and here's what I'm feeling. So a student who's learning medicine really needs to learn how to meet the patient where they live, where they're coming from. And patients aren't coming from a disease perspective, they're coming from here's how I'm feeling. And that's how the book is really designed. The first edition of the book was written in the 1980s by Dr. Robert Seller. Dr. Seller was a past chair of the Department of Family Medicine. He was one of my attending physicians when I was a medical student and a resident. He's not in clinical practice anymore, and when it came time to write the 6th edition, he realized that he needed some help from a practicing physician, one who has an academic bent, who likes writing, who likes research, help him write a 6th edition that's clinically relevant. So he asked me several years ago if I would help him do that. So we spent about a year and a half going chapter by chapter, doing new literature searches, updating the tables, updating the chapters, and I really feel privileged that I was able to contribute to a book that's such an established success for really many years. I mean, this book in previous editions has been translated into many different languages. I believe it's been translated into Chinese, Russian, Polish, Italian. So to be asked to contribute to this work was a real honor. And again, in addressing students and residents who have aspirations to get into academics, I would say you'd be very lucky if you can find a mentor who can get you involved in something that they're doing, and that's often your stepping stone into getting involved in publication. We've made it clinically updated, clinically relevant, so there were some things, medicine changes all the time, diagnostics change all the time, and so I would say that the diagnostics are now clinically relevant and up to date. This book was published in January of this year, so that's one thing. The other is that we've added some online features, so there's PowerPoint presentations that instructors can use to review the chapters. There are some sample questions that students can use as a review. So I think those are among the highlights of this edition. It's a great book for anybody who's going to work with patients. I know that traditionally it's been used by medical students, particularly medical students who are involved in problem-based learning environments where they too are learning medicine through how patients present. So if you're in a problem-based learning environment where you're studying about patients who complain of abdominal pain, well, this is ideal because then you can go to this book and look for an approach to the patient who says they have abdominal pain. It's also been used a lot for people in the allied healthcare fields, nursing, physician assistants, nurse practitioners. So I think anybody who is going to interact with patients, particularly in a general, general medical environment, would benefit from it. I think that this book is unique in that it is a symptom-based approach. And I think that, again, patients do not present as pneumonia or as diverticulitis. They present with abdominal pain, they present with shortness of breath. So I think that if you're going to want to teach students to care for the patient and not just their illness, it's great to start from where the patient comes to you, and that is with an actual medical concern. And then from there you develop a differential diagnosis of these common complaints.